Welcome back now then. With many patients still struggling to book a GP appointment, Dr Nighat is here to answer your medical concerns. We get straight to Kathy. Hello, Kathy.
Hello.
Good. Hiya. How can I get help?
Basically, I've had conjunctivitis for over a week now. Firstly, it was in my right eye, and then it transferred to my left. Very, very swollen. I went to the doctor because it came up like a golf ball. I was given antibiotic cream and antibiotic tablets. I finished the course on both of those, and my eyes are still as bad. I just wondered if I needed to go back to the doctor or if there was anything else. I'm bathing them both with salt water, warm salt water. I just wondered if there was anything else I could do, because it's really getting me down now.
Yeah, of course. I'm so sorry that you experienced that. Kathy, can I just ask, is the skin around the eye still swollen?
Ever so slightly, yes, underneath.
Ever so slightly, so that's come down.
Yeah.
So
yes, it has.
So conjunctivitis is a really common condition. It's basically the white bit of the eye, the conjunctiva, that becomes infected. So there's two reasons why that will look red and itchy and sore, and then you get like a gloopy, sticky material. And so with children, we see this a lot as well. So they'll wake up and they're unable to open their eyes and it's sticky. Usually it's going to be either a viral or a bacterial infection, and allergies as well. So we say no eye makeup, no contact lenses, just try and keep everything away from your eyes as much as possible. Kathy, you've been given the right information, you've had your antibiotics. You tend to not need any more because now the swelling has come down, and now this is completely all down to lid hygiene. Cold flannels to bring down the swelling as well, and it's that repeated procedure. So lid hygiene maybe 2 to 3 times a day, but it gets better by itself. And sometimes I say to my patients, it can take 4 to 6 weeks to get better, because allergy effect afterwards, because your immune system doesn't realise that the antibiotics has got rid of the bug.
I see.
So the inflammation afterwards goes, and it is literally our defence mechanism to everything, and we forget, we rub our eyes.
It's highly infectious, isn't it?
So it's contagious.
Yeah.
So that's what we say, because if it's a viral infection, you can touch it and then give it to somebody else. So that's why we see a lot of it. A lot of the time it's going to be viral, it's self-limiting, leave it alone, do your lid hygiene, and it will get better by itself.
But you can't reinfect yourself with it.
You can, so we will say things like, there's always hand hygiene, because it gets transmitted through touch. Make sure you're not sharing flannels or face towels at home as well. And if you get better, unfortunately, if you get infected by somebody else who's got conjunctivitis, you can get it again. So it's such a common infection. But allergies is a thing that a lot of people forget. They say it's conjunctivitis, it must be viral or bacterial, but hay fever, antihistamines play such an important role when you're dealing with conjunctivitis.
Well, Kathy, I'm sorry we haven't got an instant cure, but it sounds like you're doing all the right things, so I hope that clears up soon enough. Fiona's on the line. Hi, Fiona.
Hello.
Hello. So you've got a question about the contraceptive injection?
Yes.
Okay, far away.
My 15-year-old daughter recently had the injection in January. We noticed within about a week to 10 days after having it, major mood swings, and also a change in her personality. She used to be very outgoing. She's now more reserved. She likes to sit in a room all the time. She's not talking to friends, and she seems to be snapping at everybody for the slightest thing.
And you think there's a link between her sort of behaviour change and the injection?
I've been back to the doctors, and he told me it's nothing to do with the injection at all.
Oh, okay. I apologise that you've been given that advice. So firstly, do you know what, Fiona? You're on the money. The injection, let's break that down. What is it? It's basically methyl progesterone, so sometimes known as a Depo. It's got progesterone in it. Now we know about 10 to 20% of women out there are actually progesterone sensitive, or we say progesterone intolerance. Why is that? Is because progesterone can actually affect our mood, it can affect the way we eat things, it can affect maybe our weight as well. We know progesterone affects our gut, so that you can get bloating as well. And obviously it changes your cycles as well. So you're not wrong in your decision, and actually your GP probably doesn't know about progesterone intolerance, because a lot of doctors don't get women's health training in this country and don't understand the mechanism.
Which is absurd.
Which is absolutely absurd, and that's why the Women's Health Strategy, we're trying to change that on a governmental level.
So she's got to go back to the doctor and say, you're wrong.
Yeah, so, well, yeah.
In the nicest possible way.
In the nicest possible way. Because I do women's health and I give the Depo injection in my surgery. And one of the caveats I say to women when I give progesterone, and this is any type of progesterone, this could even be HRT that we're giving, because we give a progesterone component there to thin down, protect the lining of the womb when giving estrogen. So progesterone will affect you in 4 different ways. So this is very genetic. Psychologically, you'll get either irritability, irrational anger, sleep issues, brain fog. You might actually find that you are irrational, panicky, anxiety. It can also affect your boobs as well, so you can get breast tenderness as well. Gut, it can also affect you sort of getting bloating, even getting constipation to diarrhea and changes. And then also it can affect you vaginally as well. So you might notice that your bleeding pattern changes. With the Depo-Vera, it stops your bleeding. The Depo injection lasts for 12 weeks. I really need to emphasize, this does not mean that you are allergic or you can't have progesterone. The Depo injection is a synthetic version. So what we might have to do is change it. It could be that she might need to go on the pill version of the progesterone because that's slightly different. She might even consider a coil. And this is the other myth. You can have a coil, which is intrauterine hormonal coil in anyone, even if they've never had a baby, because that's the other myth. You have to have a baby and then you can have a coil. You don't. So there are different types. So a mini coil like a JDS that we can insert as well. So it's just trying to find and tweak what side of progesterone will suit.
Does she have to wait for, you said the injection works for 12 weeks. Does she got to see out this 12 weeks before
Yes,
she can,
unfortunately, we don't have enough data to say to women to then give up another hormone on top of that, unless it's really overriding their symptoms.
Yeah.
And sometimes if it's really mood related, then we can, so sleep. I sometimes give an antihistamine medication, like a drowsy medication to help them to sleep.
Yeah.
Or even a very, very low dose antidepressant, not because you're depressed, to override the progesterone sensitivity.
Sometimes though, it's good to know, like Fiona, now you know that it's that, like you can tell her it's that.
It does get better.
It helps.
I was just about to say, if you're recording
does.
this, then maybe show this to your daughter, because that might explain to her how she's feeling.
Yeah.
And that makes it maybe less, she might be a little bit scared herself.
Of course. And this is where I think that we don't give enough education around contraceptions and the types and the synthetic versions. Not to brag, but I've done a TikTok on this as well, that you can show your 15-year-old, because this is something that I come across a lot as a women's health GP.
Right.
Well, we should do contraception.
Yeah, I think we should.
Just thank you. I hope that helps. Get back to that, doctor, or maybe ask for someone else in the practice.
Who does women's health, yes. And it might be the practice nurse who does contraception all the time.
Very, very quickly, Becky says, my son has recently been prescribed antibiotics. I've heard that you shouldn't have dairy products or fruit juices whilst you're on it. Is that true? Yes,
it is sort of true. You have to take that with a pinch of salt. So we say dairy products like cheese, milk, 3 hours when taking antibiotics. So leave that gap, but then it's okay.
I've never heard that.
Yeah, there's a small data study that was done to show that when you're having antibiotics, leave it at least 3 hours or so. Don't have, say, a glass of milk with your antibiotics. It's because of the way that it gets digested in the gut.
Wow, I've never heard that. Very good. Thank you. Thank you very much. But still to come, get ready to meet DCI Jessica James. Sinead Keenan will be telling us about joining the cast of the hit drama Unforgotten. That's right after the break.